Hi, hello, welcome back to our channel. So in last two videos, we have been seeing the coding and facial aesthetics and their courses and their face structure and when it is getting started and all. So now we are going to deal with implants and how implants is interesting and who all can do the implants and what is the advancement in it and how far we have come from ancient part of implant to now latest advancement, how it has developed and all. So even this video, I'm not going to be alone. I'm going to join with Dr. Murali Mani, oral and maxillofacial surgeon, craniofacial implantologist, facial esthetician, mentor and advisor in easy implants and easy recon, founder of Academy of Craniofacial Surgeons, JJM Healthcare Solutions, JJM Medical Trading, JJM Craniofacial Implants and Center, JJM Facial Aesthetics. He completed his UG in Dentistry and PG in Oral Maxillofacial Surgery and Implantology from Sri Ramachandra University, Chennai. He works as a professor in Oromaxillofacial Surgery Department at Sri Venkateshwara Dental College, Wales University, and holds fellowship in Cosmetology and Facial Aesthetics. He had done various publications in national and international journals. With his unique cases, he holds an experience in his field for more than 15 years, where he had placed more than 10,000 craniofacial implants with a success rate of 98%, along with treatment for facial trauma, mucormicosis post-COVID cases, cancer patients, orthographic surgeries, gunshot injuries, etc. His craving in innovation and research on patient-specified implants and facial reconstruction has its team Easy Implants and Easy Recon, which is creating a new path for full mouth rehabilitation for maxilla and mandible deformed arches where the conventional implants are not possible. Most importantly, their research plays major role in rehabilitation of mucormicosis and cancer patients where we totally bypass grafting. He had recently won Best Mentor Award in National Conference of Oromaxillofacial Implantology. He travels pan-India for consultation of his patients. He guides worldwide in teleconsultation for his patients. To him, boundaries should never stop best treatment to the patients. In his Academy of Craniofacial Surgeons, the panel of well-experienced craniofacial surgeons train the budding dentists with their tremendous knowledge and experience in craniofacial surgery in different modules of workshops. Recently, they had done implantophile and workshop in craniofacial implants. So come, let's go and meet him and know more about implants and their advancements. Come, let's go. Hi sir, welcome to our channel. So how are you sir?
Yeah, fine.
So implants are something which people get afraid about, but from the doctor's view, the implant is the best option treatment to replace the teeth, mainly when it comes to full mouth rehabilitation. So as you have 10,000 plus implant experience with 98% success, you will be the correct person to tell about implants to the people, sir.
Actually, implant, what is happening is it's not implant is not a new procedure, which is done by almost 3,000 years back. They have started doing an implant. If you go for an history, you're able to see all the type of implants what have done from our ancient peoples and all. So in India, it's almost 10-15 years back only the implant was with. It's more talked about implants. Actually, implant is very simple procedure when compared to rest of the replacement procedures. So with my experience, I can tell you, go for the implant wherever you have a missing teeth. That is the best ideal treatment, and you will have a nice success rate, and everything you can able to see it. Okay.
Okay, sir. So, what are the types of implants we have, and what is the new advancement, sir?
Okay. Actually, type of implants, if you take the almost 100 years, if you can, there are a lot of variations have been come down. So recently, what we are practicing in India and all over India, it's like very small, very concise part of implants. Like we can tell, like conventional implant, so and you can go for a zygoma implant, pterygoid implants, and now the recent advance which you have asked is a patient-specified implants. It's a new type of implants which we can able to customize it for the patient. These are the variations of implants are available in India.
Okay, so you have experience in all types of implants. So how this new advancement called patient-specific implants or easy implants are helpful, and can you share your case experience, sir?
Patient specific implants, in the name itself can be able to identify it's a customized implant which we can able to specify the implant size and everything according to the patient bone structures, according to the bone height, width and quality of bone we can able to customize. So we are into the research for the past 3 years. We are manufacturing, we are actually a group of maxillofacial surgeons and prosthodontists team up, and we are into the research in doing a patient specific implants, and we got a success rate almost 97 to 98% in patient specific implants. And we will suggest this implant only for a most atropic maxilla and mandible. There is a hopeless case for go for a conventional implant, and the patient can't able to go afford it. For if it, we can in common term we can tell, like in the doctors, that if the patient is going for a want to go for a full mouth rehabilitation, but the patient won't be having a proper bone quality, so we will be suggesting to go for a pterygoid implants or zygoma. Past 5 years back itself, they have till past 5 years they are doing a zygoma and pterygoid for the atropic maxilla. So, but to that cost effect is more higher. So to break down that cost effect, and we have to reach the patient, very all the type of patient has to go for an implant. That is our aim. So nobody should go like Asha Brenmark, our father of an implant. He used to quote for a thing for an implant. No one should die with the teeth in the glass of water. So I am a fan of Brenmark. So I want to do what he has started. So I don't want our Indian people should not die with the teeth in the cup of water. So we need all the people from higher version to lower version, all the type of people has to go for a implant. That is my aim and motto to start it. So we have started to go for a research. What can be done is very low cost to give a complete denture or with a fixed one. So we replaced, actually I can tell we are replacing, when you compare to zygomatic implants, the cost will be very 50% lesser than when you compare to zygomatic. So the patient will be more comfort for paying what we are doing. So it might be in another 3 4 years I will be coming into the market with a high thing that it will reach all the people. So
Okay, sir. You have done so many different cases, and one among them is this surgical reconstruction in a gunshot and bomb blast patient. Can you please share the case experience, sir?
so that is I have done a lot of I think maybe 5 6 years back I have done. It's a quite interesting case about gunshot injury and also bomb blast. We have handled both the cases. One is from African continent, the gunshot injury, who had undergone a gunshot injury in the bar. So he had done a local treatment in the emergency treatment in his hospital over there. But they removed a mandible segment part of the anterior mandible. They have removed it, and they have come to India. And once he come to India, we have faced a lot of medical legal issues. Medical legal issues also we have faced some legal issues also. With we got some approval, we have to get it, because it's not a normal injury, it's a gunshot injury. They have to get clearance from that continent to India. So it's involved with the Ministry of India and the African continent. So we have got a lot of challenges that time to get an approval for everything, and we got a local approval also where we are operating also, because he is not a normal Indian people. He is an NRI who has come for a treatment to India with the history of legal issues. So we faced, and we fought, and we got the approval and everything, and we have done a nice reconstruction for his mandible. And the same similar type of case which we got illegal issue, the one more case patient is a bomb blast injury. What we got, he is from Sri Lanka. Obviously, everybody knows. Actually, we had a war during that time. India, in Sri Lanka, the war between Tamilian peoples and the Sri Lankan army and everything. So he lost, actually, he lost his whole family in that bomb blast. He was sleeping in home. So he got injury in bomb blast, his wife and daughter, everybody is there, but he survived. So they have done the same type of resection of mandible in Sri Lanka, and he has come to India from Chennai to reconstruct his mandible. So we have done a reconstruction that also. This is very interesting, and these both the things what we got, I got personally what experiences with the legal issues also got experience. It was a good, and I can able to guide everything who is coming from NRA in this type of, because I was into that thing for almost 6 months get approval. So I was seen from lower people to higher people to get approval. So it was a good experience, and the patient is very happy. And even for the reconstruction, we have done with the fibula reconstruction. Within 3 days after reconstruction, patient was started to walk also. But after even the removal of fibula also. So he was happy, and both of them are in contact now till now. They are very happy with it, and we are just following every year, yearly once.
Okay. So that was very interesting. So now we got more facial bone destructions due to COVID mucormicosis. Is there a possibility to reconstruct them also, sir?
Yes, our main reconstruction, that patient specified implant, we call it as easy implant. In reconstruction part, we call it a easy recon. That is the another term which we have kept. So we have started to reconstruct the maxilla itself. We have done quite number of cases. Almost we are nearing to 100 cases now
Wow.
for a reconstruction for mucormicosis. Those patient who has got undergone a maxillectomy, partial or total, we are doing a reconstruction for that maxilla itself. So with the help of easy recon, so the patient is getting permanent dentures with combination of obturator with screw retained, which we call it in all on 4, all on 6, like hybrid denture. No? Same type of screw retained denture with the obturator, we are able to give the fixed one for the mucormicosis resected patient. So we are actually upper hand in India itself. I can tell proudly that we are the one who is doing reconstruction for the maxilla with the reconstruction with the help of easy recon. So that's a team of the surgeons which we are told no previously. The same team we are operating all over, and we have lined up almost 30 to 35 cases in down another 6 months. We have it.
Oh.
Okay, but it's unexpected one which happened in, all over the world, COVID, and it was affected those who are a very compromised patient and all. So that is actually good, but we are helping out. So people who is want to go for a reconstruction, that if I can, the dentist which I can say no, they used to see partial maxillectomy or total maxillectomy patient in their clinic. They would have come for a obturator or something. But if you go for it, it's a removal obturator which we will be giving. But I can give you the permanent fixed obturator with the denture, with the help of easy recon. So if the patient is willing, because our dentist will ask to know what is happening in dentistry. This is the reason advance which we are doing in India. So if you can able to see patient, then you can suggest the patient. The patient lifestyle will change, because if you go for a removal obturator, the patient can't able to hold it. It's all floating and everything. He doesn't have a maxilla. He doesn't have alveolus, nothing. So it will be very hectic, and he won't wear it. Then the patient has to go for a rails tube into same thing, food in same. So patient lifestyle will be very horrible. So if you suggest, the patient will be very happy. But nobody doesn't know what is happening after maxillectomy. I think they can approach us by seeing this.
Videos.
Yeah. They can go for. They can save the patient lifestyle itself. They can change it. They can go for it.
So even this can be done in cancer patients, sir.
Yes. Yeah, reconstruction for the mandible, total mandibulectomy, we are doing it with the help of reconstruction, easy recon. We are giving the full mandible itself with according to the patient's specific. Till now, what we have, no, it's a reconstruction plate. It's customized. It's not a customized. It's a default format you will be having. But after PSI, the patient specified implant with the 3D technology, we can able to construct the mandible itself, titanium mandible, according to the patients.
Oh.
So it will be like putting a shirt, like customized tailored shirt. So you will have proper fit and guide. Everything will be proper. So along with that, we are able to give the abutment also. And after reconstruction of the mandible itself, we can able to give the hybrid denture, fixed. So this is it's a good thing, which nobody knows our dental field. So I want to explore. I want to tell everyone this is what happening in dentistry. That's why I came for you. Okay.
Okay, sir. So, this easy implant and easy recon is technique specific, sir. Only certain people or certain dentists or certain specialized dentists can do this, or anyone can do, sir.
Actually, initial stage I will be suggesting to go for a specified surgeons, because I can tell, like, because we are into the field of research and thing, and now till now we are not given to other people. Wherever you have a patient or something, we are coming into there and we are giving them. So as of now, it's a technical specific, not that much, because everything is done by 3D technology. Everything you can visualize in digital itself. What will be the end result? So as of now, we are into the team of doctors, which we are doing. But the patient, if you see any patient in the clinic, if you want to go, we will be coming and giving you the suggestions, and we will be giving you consultations, and we will be guiding you, and you can come and assist initial stage. Then you can go for it. If you assist for 2-3 cases, then you will start doing it. It's so easy when compared to zygoma and pterygoid. Actually,
So, sir, we know you are owning a academy for all craniofacial techniques and courses. So, do we have a specified course for this, sir?
yes. Actually, we I run an academy. That academy called as Academy of Craniofacial Surgeons. It's a group of surgeon and same prosthodontists. So recently we have conducted a course for implants that we call it as Implant of 5. So it was a good course which we have conducted, and lot of young doctors have come down and they have learned all type of implants. In that course, we have conducted all type of implants, like conventional implants, zygoma, pterygoid, patient specific also we have given one day. So there are many people are coming into for what is happening in dentistry. So this course will help them to get upgraded in what is happening in dentistry. So this will be coming on reason every 3 months or 4 months. We will be keep on doing it, and it will be very benefit to. My aim is every dentist has to practice implant. So I don't want to hide anything. What is implant? I don't want to say that the implant is very big procedure. It's nothing. It's like that. So once you attend, if you learn, we will be teaching you and we will be giving you a confidence that implant is nothing. It's very as simple like doing a scaling. Only thing in our college life, nobody is taught like that. Nobody is given guarantee or nobody is backed up us to do an implant. So that to be breakdown. So that is my aim.
So, as you thought that implant is so easy, what was your experience from your first implant case, sir?
Okay. First implant patient, yeah, that is almost 10 years back I started doing a first implant. That time it took me almost for placing an all on 6, that is for mandible, that too. So it took me almost 2.5 hours for placing a 6 implants. Now it's I can finish off in half an hour, 30 minutes I can finish off all 6 implants. So that is the confidence which I got it by the experience. Hope I need everyone should do like that, because it's as simple. That's why, because now the implant company itself is changing their technical terms and all, technical issues and all. So they are giving it as simple as possible for doctors to place an implant. So that is my experience.
Okay, sir. So, is this like a fellowship course or a training course, and what all will be included in this course, sir?
Yeah, it's a training course actually. It's Academy of Craniofacial Surgeon. We'll be giving a training course for the implant, complete implant. Once you attend over here, you will be fully knowledgeable and you will be full confident to place an implant. So that is the training program which we are doing, and you can and we will be supporting you for lifetime from our academy. All our surgeons and prosthodontists, once you panel into this our ACS, you will be lifetime with us. So you will be having more confidence whenever you have a doubts in whatever time, 24/7 you can, because now the technology is started. We have a Zoom calling, WhatsApp calling, groups and all. So we will be active all the times. We will be guiding you. If you see a patient in the clinic and you want to tell the patient whether he can go for an implant or not, then you will take an IUPA or you put it in the group. You can ask us whether yes, you can go. Sir, how can you? You can proceed. You can tell the patient how many days you have to wait, when you can give the crown and everything. We will explain you. You can, if you have a doubt. Because this support, it won't be it's not for a few days, it's a lifetime. We will be supporting, and our panel doctors, surgeons, and the prosthodontists, everybody is actually professors. They are almost 10 years experienced field surgeons. So So nothing to worry, and we won't misguide also. We'll be supporting you always. So don't worry and don't lose your hope, and don't think that we just a dentist we can't able to place anything. Actually, in dental field, if you done a BDS, you can practice an implant, but nobody will tell that. Okay, we have a rule. I have gone through all the medical legal issue, no, which we have. That times I have no. Even with our BDS, we can able to place our dental implants also. You just need you have a training. That's it. That's why I am telling you. You just go for a training program. Just learn it. You do it. Nobody will question why you have done. You are not an implantologist. Not like that. You are actually a bachelor of dental surgeon, which you can place an implants. This is our Indian rule. So don't worry and be confident and do start doing implants with a training program. Once you have done a training, then you can go for it.
So do we have a hands-on with it, sir?
Yes, obviously hands-on. We will be giving in dummy models and also in the patient. I will be teaching you each and every one to place an implant with my guidance and with my surgeon and cosmetologist. He will be teaching you all the components, how to place, how to put a cast, what is transfer coping, what is open tray, closed tray, whatever thing. That will be a very confusing stage. Nobody will explain properly. But our people, which are our team, no, they are very eager to teach everyone. They are not like I have to minimize my knowledge to share the knowledge to others. They are not like that. They are ready to share what they got experience. So that type of team only I have it.
Okay. So by doing this course, can we call it as a implantologist by putting certificates?
Yes. Yeah, you can put it as an implantologist in your certificate. You can place it in the clinic. You can after BDS you can put it as an implantologist. No issue because you have trained already. Because with the BDS itself you can put it. But with the training, if you put it, nobody will. The patient will be happy to see your board. Yeah, he is an implantologist. So for the advertisement purpose only we are going to put. But actually, you are eligible to do an implant. Nobody will question you. You are not eligible. It's a wrong way. I know that. That's why I told. I know the legal issues. So you can put it.
Okay, sir. So, what you will suggest the budding dentist over, sir, and do you please tell us about the other ways to go into dentistry after BDS?
If you are interested in any field of dental field, any subject like ortho, endo, prosto, whatever, or implant or surgery, you can go for any training program. You can start practicing. But only because most of the field, medical dental field, all we have a knowledge, but only in surgical part only most of the dentists won't be having that much knowledge about the fracture management and tumor management, orthodontic. These and all they can't able. They are not that much knowledge. If you ask me, I will ask everybody to go for a surgery, PG. Okay, go for a MDS surgery. Then you will be more confident in doing all the things. Once you start seeing the whole skull with the maxilla, mandible, everything open, then you won't be get feared of doing a small extraction, small gum treatment, whatever prosthetic work. Then you will have more confidence because you are seeing the big thing. The rest of the thing will become very smaller for you. So you will get more confident. Then you can start doing all the procedures. So I will suggest first thing as a surgeon, I will suggest obviously go for a YMFS. Then according next thing, whatever you are interested. That is my suggestion. Okay.
Other than MDS, what all options we have, sir?
Yeah, you can go for a facial aesthetics. Yeah, cosmetology you can get trained. Even now BDS we can able to do cosmetology procedure also. You are eligible to go for a Botox, fillers, whatever cosmetology procedures. No, that and all you can able to learn. If you are interested in doing beautician work like aesthetic work, you can go for a training in cosmetology, then get trained. Even hair transplant also we can able to do if you get trained. So that is also possible. That is also eligible. We are eligible for that actually. If you, only thing my worry is you just get trained proper way, then do it with the proper hands, proper backup. Then you start doing whatever you like. These are other options once you do a BDS. You can get it if you go for clinical practice. These both things will help you. Cosmetology also will be helpful and implant also will be helpful.
So, what is the upcoming courses in your academy, sir? And what are the timings and how to register for it and all?
Yeah, coming every 3 months our academy will be conducting a program. So we are, last month we have done implant, and this another Feb month we are going to do a aesthetics, we call it as. So that's which we include all the procedure like cosmetology procedure like Botox, fillers, PRP, PRF, that complete package. It will be done in 4 days. It will be completely. We won't be having that much time to learn. Also, we have a lot of subject in that, but it's very simple. Only the basic knowledge you should know: basic anatomy and marking, muscle attachment, nerves, and all. If you know, you can. Then after 3 months, then again we'll go into another. That will be upcoming events will be there. Every 3 months once we will be giving you
Okay,
courses.
sir. So what will be the price cost for this aesthetic course?
Price cost will be starting from 45,000. So that will be the price cost, and you will be given you hands-on in the patient. Volunteers will be there, and you can able to place it all the Botox and fillers. Because why we are a little bit higher, we can, if you think, means because of the material cost. So it's not as simple like because all the material which we are using, it's all branded one, and that and all. It's, if you go for a branded, mean obviously it will be costlier. So that's why the version will be quite a higher fee, but you will get a nice exposure. And only thing what I'll say, if you're learning, go for a proper quality learning. Even with the material, you have to go practice with the quality. Then your lifestyle and your way of practicing also will be same way. The patient, then the complication will be less, whatever procedure you do. So obviously start learning with the quality of materials. That is my suggestion.
Okay, so thank you so much for your time. And so, if you are interested in joining the academy for aesthetics or implantology or whatever may be the courses in upcoming days, you can just register it in the link given below in the description. And we have discussed the aesthetics in detail, so that video also we have given in the description. And so, do like, share, and subscribe. Thank you.
Thank you.